I would like to introduce you to our next speaker, who almost everyone in this room knows, I think. Jill Escher. She wears many hats in the autism world. As president of Autism Society San Francisco Bay Area, she advocates for the lifespan needs of adults with autism. As owner of Clarendon Properties, she provides affordable housing to adults with developmental disabilities. As an autism research philanthropist through Escher Fund for Autism, she funds cutting-edge research on causation of neurodevelopmental disorders, so she never sleeps. She's also the president of a new organization, the National Council on Severe Autism, the mother of 2 children, Johnny and Sophie, with nonverbal forms of autism. Jill lives in San Jose, California. So please help me welcome Jill Escher.
Hello, everyone, and I want to thank Gianna, and I want to thank Sister Rosemary for this incredible event and hosting us on this beautiful campus. I'd never seen it before, and I'm overwhelmed. It's so wonderful, so impressive. I wish we had that where we live. So as you just heard, I wear many hats. I have many jobs, and I'm going to get people are going to be able to see me now. Yeah, and I'm 5 feet tall. That's what the buttons were for. Okay. But my 5th job, which is not listed here, is as a mother of 2 children with nonverbal forms of autism. They are part of this rapidly growing wave of people with autism who are encountering a system that's very much unprepared for their needs. I'm going to start off by talking about this new group, the National Council on Severe Autism. Let's see if I can get this. Sorry. You've never heard of it. That's because while we are a legal entity and a functionally operational entity, we have not yet announced ourselves. We don't have a our website isn't live yet. We aren't on social media. You haven't heard of us. Hopefully next month you'll have heard of us after we dot our I's and cross our T's. What is the NCSA? The NCSA is going to fill a very important advocacy gap. We do have some rather good autism organizations. I'm president of one of the affiliates of Autism Society of America. And these groups do good work. But there really has been an amazing amount of silence on the issue of the needs of those who have more complex, more intensive needs because of the degree of their cognitive issues, their functional issues, their behavioral issues, and medical issues. So we are formed to stand up for those individuals and those families. And you can see our very simple mission statement up there. We will be educating the public. Often the public thinks of autism as the good doctor, or as, I don't know, you think about Down syndrome, an actor, right? No, this is a population that, really has severe and significant impairments that should not be trivialized. We're going to issue position statements and hopefully do a lot of education on very important social issues affecting our community. And what would that include? Well, that would include the CMS rules, which frankly are absurd for our population. As the mother of 2 people with severe autism, I find these rules utterly preposterous. I don't care if they can access food at 5 in the morning. Are you kidding? I care if my nonverbal autistic daughter is at risk of rape because she's not in a properly supervised environment. Where is that in the regulations? And of course, we will be issuing statements about sub-minimum wage because our people are not worth the minimum wage for the most part. My kids, they won't do anything you request of them. It would be absurd. And not only do they not do anything you request of them, they need people supervising them as you request them to do things they aren't going to do. So they're very expensive. They're the reverse of minimum wage, right? These are just my kids. It's a very, diverse population, but it's absolutely essential that we retain every single vocational choice for this population. It's absolutely insane to think that these people are worth, in my world, almost $15 an hour. We want to provide a platform for think tanks, something like this. We want to be able to bring serious-minded people together to help craft new policy and create some momentum around these issues. Of course, we want to educate policymakers, because let's face it, our policymakers are out to lunch about this stuff. They haven't met kids like mine. You can't bring a kid like mine into a legislative office. The last time I did, he started ripping off some of the certificates on the assemblyman's wall. We want to promote research. This is not really relevant to what we do, but we want to promote research into therapeutics and other things. And of course, we want to promote acceptance and awareness of this population. Again, we're not the good doctor. We are people who are often ripping out shrubs as we're walking down the street, which would be my son. So we have a number of problems. I will discuss just 4. Huge problem, and no one's actually mentioned it today. And that's not surprising, because almost nobody talks about this anymore. But we are experiencing an absolutely colossal explosion of the population of people with autism. And this graph is California's DDS, Department of Developmental Services numbers, comparing 1987 cases to today. About 2,700, and today about 107,000. And they say, well, that's just better diagnosis. We're just noticing it more. That's diagnostic shift. No, it's not. Everybody who's looked at this data says, well, that might play a small part, but that can't possibly explain the ridiculous increase in prevalence of developmental disability type autism. People say, oh, it's just people who are quirky and different, and we're just broadening the definition. No, this is comparing apples to apples. And if anything, the state of California has elevated its bar for eligibility into the system, not lowered it. It's an incredibly dramatic social crisis that we're facing. So we've seen a 40-fold increase. Autism, which was once incredibly rare in California, is now 40% of the DDS caseload. Our adult population will quadruple in the next 20 years. Anyone can go online and get the DDS data. You can get out your calculator, do the math yourself. Autism cases are typically more complex than other eligibility categories, and the demand for services already outstrips capacity. So we are facing a unprecedented crisis, because by the time I walked into that reception last night, I had already had 3 conversations with people about the changing profile of the developmental disability community. How it used to be a lot of Down syndrome, a lot of CP, a lot of epilepsy, and then some odd, rare genetic diseases. And now all these providers are seeing this influx of people with autism that they didn't really see before. So this is creating an unprecedented crisis. And I do want to say this is probably not a popular thing to say among this crowd, but I'm a truth person. People with developmental disabilities used to have fairly short lives. It wasn't that common that parents would outlive them, right? But we have better health care now, better drugs and all kinds of things, and better care. So often they are living longer, but with respect to people with autism, they by and large have normal lifespans, which again was very rare in the DD community. Another problem, everyone knows this is why we're all here. We age and we die, right? Who's going to care for these 107,000 adults with serious autism in California? Probably more like 800,000 nationwide if we extrapolated. We don't have an answer, and Lord knows the HCBS rules don't have an answer. This population is so big, and nobody's talking about making the social shifts we must make. Here's another problem. Something we haven't talked about today, but it is the elephant in the room. Adult autism is astronomically expensive. This is just an incredibly conservative estimate of what it costs per year to care for an adult with autism outside of the family home in my ultra expensive area, which is the Bay Area. So I made them conservative because I don't want anyone to point the finger at me and say, well, Jill, you really exaggerated that. No, I underplayed it. And it's about $200,000 a year. And this is not a group home model. This would be a little bit more like a supported living model. Okay, multiply that by the number of adults with autism aging out of the school system, and we have a bankrupt system. So we have to talk about the money. We have to find the efficiencies. Next problem. Well, our system was not designed for this large and complex an autism population. It just didn't exist. It didn't exist at the time these policies were drafted. What did we learn earlier from Mr. Cheslovsky? Well, HCBS rules were crafted in the early 1980s. Autism wasn't on anybody's radar. If you look at the autism data, the autism the first year, birth year, that the autism cases started their uptick was around 1981. And then it's kind of gone up exponentially since then. So the increase in autism wasn't really detected until the late 80s, early 1990s. And that's when people like in the Department of Developmental Services in California started to get very alarmed. They had never noticed this before. But all of this entire system predates the autism explosion. And we really haven't done very much to update our policies to match the realities that we're seeing in the field. Instead, what do? Oh, you know what? That actually used to work, and then we converted the file. I said we engage in wishful thinking. That's what we do instead. They'll all get jobs. It'll all be fine. All right, so what are we going to do about it? Well, I don't know. I just wanted to throw out an idea, and I knew that this audience would be filled with incredibly intelligent people, so I thought I'll throw it out to you intelligent people. 501c3s, tax code. Well, one of these things is not like the others, right? The Metropolitan Opera, the San Jose Quilt Museum, the Buster Keaton Appreciation Society. These are all 501c3s. They're great. And then there are places like Misericordia and the Morgan Autism Center Adult Program, which is where I live, near where I live. One of these is an essential care nonprofit, and the others are very wonderful to have, and they're culturally relevant, but they're not, we can live without them. Or rich people can pay for their own opera tickets, right? So why are we treating all these nonprofits under the same umbrella? In the eyes of the law, these are all kind of morally and financially kind of equivalent, but they're not. We have this explosion of people with severe needs, and they should be treated differently. So that's the premise of this idea of the, oh yeah, I'm so sorry. We had to transfer files, and I'm not usually this sloppy. That just happened. That is the genesis for this idea of the essential care nonprofit. That these entities that provide hands-on care to people who cannot care for themselves, for people who satisfy that Medicaid definition of being at risk for institutionalization because of their cognitive and functional deficits, that they are special and that we should do things to facilitate their creation, to create a nationwide network of these various nonprofits. But we do need to change the rules of the game, of course, to get there. So, of course, we are just in the brainstormy phase right now. So here I'm saying, like, how do we define an ECN? This is just me brainstorming. This is not vetted through any congressional committee, let me assure you. So again, but my feeling is you have to start somewhere. You have to get the mental wheels going if you're going to end up with any change. So this is kind of an exercise. So I see ECNs as, I can't read this, sorry. As something like lifeboats that provide essential basic human care services to adults who meet that Medicaid definition, and where the services could include things like aid support, day programs, supported employment programs, housing, medical care, daily living coaching, and behavioral and other forms of therapeutic care, not unlike the things we see here on this campus. And it should be that, if you're going to be a special nonprofit, really the bulk of what you spend money on should be in that essential care. It shouldn't be in other departments, right, that might be necessary for the functioning of that organization. And I think that there should be a very high level of accountability. So there should be special audits, right? There should be special rules that people adhere to. So how would it be different, though, functionally? How would it be different from the Quilt Museum? Well, I think if you think of the ECN as a special boat, you can throw in whatever packages you think you need to sustain that network of nonprofits. So what could be some of the benefits? Well, maybe donors to ECNs get a tax credit instead of a tax deduction. Because when you think about it, ECNs do what used to be considered a basic government service. And when you wrote that tax check, right, that tax check went to the institution or the ICF or whatever, or part of that tax check, to help support this community. But now the government's like, no, not doing it anymore, not in that game, no more. But all of a sudden, we're supposed to kind of crowdfund this stuff all of a sudden for this huge population. So actually, I would say that just logically, a credit instead of a deduction makes legal sense. Someone likes my idea. Okay. ECNs could also feature a special rule. Right now, 501c3s, well, I can't really donate to a 501c3 that specifically, helps my kid. I mean, it might incidentally help my kid, but I think that when you're facing a crisis, an emergency situation, which is what we are indeed facing, you have to absolutely get rid of that rule for this population. I was talking to somebody last night about how if a family wants to help support services in a residential community that's funded by Medicaid, that's Medicaid fraud, right? Well, that's wrong, because these communities can't live on Medicaid, and these families want to help. We have to make it more possible for families to be full partners in this form of nonprofit. ECNs can carry any number of other benefits. They can have special priority for HUD programs. They could have government contracted purchasing rates. They could have special labor or immigration rules. There could be, did I just say labor? That kind of relates to the last thing we just heard, doesn't it? ECNs would, of course, be exempt from federal income taxes. And I would imagine that there are other kinds of taxes that you can play with, like in states, that they could be exempt from property taxes, which are really a big deal in California. But getting that exemption is very hard. I'm not going to go into the details as to why, but if you're an ECN, you might just pass go, whatever. Don't collect $200, whatever. You just get a direct exemption. Now, is this idea politically feasible? The answer is I have absolutely no idea. I have no idea. All I know is that the system right now is not fair. This system right now is not responding to what is clearly a growing crisis that is only going to get more acute over time. And we have to make some sort of change. We have to create some sort of new boat in which we can put all these special rules and all these special sustainability measures so that these parents can die, right? I mean, it's going to happen. This is an inevitability. I don't have to go to Vegas and gamble. This is inevitable. So what we know for certain, as I think all you will agree, for the lifespan needs of our adults with autism and intellectual disabilities, failure is not an option, and we need to create more choices and more policies. So for more information, pretty soon you'll be able to get on the NCSA website, I hope. And you can also see our work at Autism Society San Francisco Bay Area there, and that's my email address. Thank you.